Which of the following best describes the purpose of point-of-use treatment of surgical instruments? A. Prevents the need for cleaning. B. Reduces bioburden and prevents drying of soil. C. Sterilizes instruments immediately after use. D. Disinfects instruments on the surgical field. Answer B. Point-of-use treatment helps reduce the microbial load, bioburden, and prevents the drying of soil, making later cleaning more effective. What should be done immediately after the use of instruments in a procedure to aid decontamination? A. Return them to the sterilization area. B. Soak them in enzymatic detergent. C. Wipe off visible soil and apply a pretreatment foam or spray. D. Place in the autoclave. Answer C. Wiping off visible soil and applying a pretreatment solution prevents drying of organic material and simplifies subsequent cleaning. Enzymatic sprays used at point of use primarily function to A. Kill bacteria. B. Lubricate instruments. C. Break down organic material. D. Provide moisture for sterilization. Answer C. These sprays contain enzymes that help break down blood, tissue, and other organic contaminants. When transporting soiled instruments from the OR, the container used should be A. Open to allow airflow. B. Rigid, leak-proof, and labeled as biohazard. C. Covered with a sterile towel. D. Lightweight and collapsible. Answer B. To prevent exposure and contamination, containers must be leak-proof, puncture-resistant, and clearly labeled as biohazardous. The main regulatory agency concerned with the safe transport of contaminated items is A. CDC. B. WHO. C. OSHA. D. FDA. Answer C. OSHA, Occupational Safety and Health Administration, sets standards to protect workers from exposure to biohazards during transport. Instruments left to dry with organic soil are more difficult to clean because A. Organic soil protects microbes from disinfectants. B. Drying causes metal corrosion. C. It damages the sterilizer. D. It reduces visual inspection efficiency. Answer A. Dry organic matter adheres to instruments, protecting microorganisms and increasing cleaning difficulty. Which of the following is not a benefit of point-of-use care? A. Protects personnel handling instruments. B. Speeds up sterilization. C. Prevents instrument corrosion. D. Maintains patient safety. Answer B. While point-of-use care prepares instruments for cleaning, it doesn't speed up sterilization but ensures effectiveness. Instruments that cannot be cleaned immediately after use should be A. Left uncovered. B. Rinsed with sterile water only. C. Kept moist using pre-treatment products. D. Placed directly into ultrasonic cleaner. Answer C. Keeping instruments moist prevents biofilm formation and makes later cleaning more efficient. In transporting used instruments, what is the purpose of labeling containers with a biohazard symbol? A. To indicate sterilized instruments. B. To direct delivery to sterile storage. C. To warn of potential infectious materials. D. To show that the instruments are surgical grade. Answer C. The biohazard label alerts staff to potential infectious materials and ensures proper handling. During point-of-use preparation, sharp instruments should be A. Disassembled only. B. Soaked in alcohol. C. Separated and placed in puncture-resistant containers. D. Mixed with soft instruments. Answer C. Sharps require separation and placement in safe containers to prevent injury during handling. Instruments should ideally be transported to the decontamination area. A. Once all cases are finished. B. At the end of the day. C. As soon as possible after the procedure. D. After they are visually inspected. Answer: C. Prompt transport minimizes soil drying and bacterial growth. Which statement is true about instrument preparation at point of use? A. Instruments should be soaked in bleach. B. Cleaning should be completed in the OR. C. Debris and soil should be removed before transport. D. All items must be sent dry. Answer: C. Gross soil should be removed immediately to reduce contamination and aid cleaning. If enzymatic spray is not available, the next best option is to A. Cover instruments with a dry towel. B. Use sterile alcohol. C. Keep instruments moist with water-soaked towels. D. Begin ultrasonic cleaning. Answer: C. Moisture helps prevent drying of organic matter, which is key in effective cleaning. Surgical instruments must be kept moist until decontamination to prevent A. Rusting. B. Biofilm development. C. Electrocautery failure. D. Sterile field contamination. Answer: B. Moist environments prevent the formation of biofilm, which is difficult to remove during cleaning. Point-of-use decontamination is primarily the responsibility of A. The sterile processing technician. B. The circulating nurse. C. The scrub technician. D. The surgeon. Answer: C. Scrub technicians are responsible for initiating point-of-use cleaning before items leave the surgical field. What is the main reason for not using saline for instrument pretreatment? A. It causes corrosion and pitting. B. It's too costly. C. It sterilizes the instruments. D. It is a disinfectant. Answer: A. Saline is corrosive to metal instruments, leading to pitting and long-term damage. Surgical instruments transported dry to decontamination may A. Be easier to sterilize. B. Develop odor. C. Require less cleaning time. D. Trigger an automatic sterilizer cycle. Answer: B. When left dry, organic materials decompose and emit foul odor, making cleaning more unpleasant and challenging. Which is the most appropriate surface for transporting soiled instruments? A. Sterile drape. B. Waterproof-lined closed cart. C. Wire basket. D. Fabric tray. Answer: B. Closed carts with waterproof liners help contain contamination during transport. The role of sterile processing in point-of-use care is to A. Oversee all surgery. B. Train or staff on proper procedures. C. Inspect and sterilize all instruments. D. Manage surgical case carts. Answer: B. Sterile processing staff play a key role in educating or staff on proper instrument handling protocols. Instruments that are not kept moist may develop A. Rust within minutes. B. Pinning in plastic parts. C. Biofilm, increasing infection risk. D. Spontaneous combustion. Answer: C. Biofilm is a matrix of bacteria and organic material that adheres strongly to instruments and resists cleaning. Transport containers for soiled items must be cleaned and disinfected. A. Weekly. B. After each use. C. Only if visible soil is present. D. Monthly. Answer: B. Proper infection control requires that containers be cleaned after each use to prevent cross-contamination. One main goal of point-of-use instrument care is to A. Eliminate the need for sterilization. B. Prevent instrument inventory loss. C. Improve staff workflow. D. Ensure instruments arrive in optimal condition for decontamination. Answer: D. Proper care ensures that instruments can be effectively cleaned and sterilized without damage or delays. What is the best method to prevent drying of blood on instruments during long procedures? A. Spraying with alcohol. B. Keeping them under sterile water. C. Intermittent wiping and use of pre-treatment sprays. D. Immediate return to sterile processing. Answer: C. Regular wiping and spraying keep instruments moist and prevent dried blood from forming. Soiled instruments should be transported in A. Clear plastic bags. B. Open trays. C. Biohazard labeled, rigid, covered containers. D. Covered fabric wraps. Answer: C. These containers prevent leaks, contain contamination, and protect handlers. According to AAMI standards, point-of-use cleaning must begin A. In the sterile storage area. B. Only when instruments reach decontamination. C. At the surgical site before instruments leave. D. After reassembly. Answer: C. AAMI emphasizes that point-of-use care starts immediately after instrument use. Instruments left wet after pre-treatment must be A. Reprocessed in sterile field. B. Discarded. C. Transported immediately to decontamination. D. Left until next procedure. Answer: C. Wet instruments should go to decontamination quickly to prevent microbial growth. If a pre-treatment enzymatic foam is applied, how long is it typically effective? A. 10 minutes. B. 1 hour. C. Up to 4 hours. D. 24 hours. Answer: C. Most enzymatic foams keep instruments moist and active for up to 4 hours. Point-of-use processing includes all except A. Moisture maintenance. B. Bioburden reduction. C. Full sterilization. D. Removal of gross soil. Answer: C. Sterilization occurs later. Point-of-use care focuses on prepping items for proper cleaning. Sharp instruments should be transported in a way that A. Keeps them visible. B. Prevents injury. C. Maximizes capacity. D. Saves water. Answer: B. Proper sharps handling prevents injury to staff during transport. The role of transport personnel in infection prevention includes A. Delivering trays to patient rooms. B. Ensuring soiled items are covered and secure. C. Sterilizing trays in the hallway. D. Mixing clean and dirty instruments. Answer: B. Transport personnel are responsible for maintaining safe practices and avoiding contamination.